Every student learns in school how the brain is the most significant component of the body. But even the brain needs the heart to pump blood and deliver oxygen for it to thrive. That simply serves to emphasize how crucial the heart is. Almost everything that keeps your body alive and healthy is controlled by your heart, which is the hub of your cardiovascular system. Do you desire a strong heart? The general health of your heart and the numerous other tissues that make up your circulatory system can be significantly influenced by the food you eat and the amount and type of exercise you decide to do. Because it reduces your risk of developing heart disease, a heart attack, or a stroke, controlling cholesterol is also essential for heart health. The two primary forms of cholesterol are high-density lipoprotein, HDL or good cholesterol, and low-density lipoprotein, LDL or bad cholesterol. LDL cholesterol is present in foods high in saturated fat, especially animal proteins. Avoid that at all costs unless you want to experience significant heart disease or a heart attack. Hello everyone. Welcome to Z. Don't forget to subscribe our channel. Heart facts. Blood travels along a predetermined path to and from the heart. The superior and inferior vena cava are the two veins that carry low oxygen blood into the heart. Superior and inferior are more accurately referred to as upper and lower than better or poorer. Before being pushed into the right ventricle, blood from both veins fills the right atrium. The blood is then pushed into the pulmonary arteries, which transport it to the lungs where oxygen is added. The pulmonary veins carry the newly oxygenated blood back to the left atrium of the heart. The left ventricle of the heart receives blood as it beats, and the blood is then pumped through the aorta to the rest of the body. The exact center of the chest is not where the heart is located. In actuality, it is positioned somewhat to the left of the chest's exact center. The left side of the heart has stronger muscles than the rest of the organ, which accounts for this. This in turn resulted from the left side of the heart's ability to pump blood throughout the body in addition to the lungs. It must therefore have more powerful muscles than the rest of the heart. Dextrocardia, an uncommon disorder where the heart tilts to the right side of the chest, occurs in some persons. While most do not experience symptoms, some are more susceptible to digestive, lung, and cardiovascular diseases. The heart has a separate skeleton. However, it is not formed of bone or even cartilage. Instead, the heart skeleton is made of dense, fibrous fibers, which gives the organ its distinctive form. The skeleton serves as a non-conductive barrier to control the electrical pulses of the heart. Particularly, the dense collagen in the cardiac skeleton absorbs electricity, preventing it from traveling in unwanted directions. The heart's muscles are composed of two separate types of cells. Given that the heart's function is to continuously pump blood to and from the rest of the body, muscle cells make up 99% of the heart. The remaining 1% of cells are specialized pacemaker cells that produce the electrical pulses that time the heart's beating. Given their function, pacemaker cells truly resemble nerve cells. Like no other muscle in the body, the heart's muscle cells have their own speciality. Specifically, autorhythmicity, which refers to a cell's capacity to move at a constant speed as electrical impulses pass from one to the next. The electrical flow of the heart travels along a predetermined course. The electrical currents in the heart are produced by the sinoatrial (SA) node, which is situated along the right atrium of the heart. The exact route it takes through the heart is still a mystery to medical science. However, medical professionals are aware of its course. Electricity enters the left atrium through Bachmann's bundle from the right atrium. As a result, both atriums begin to constrict simultaneously. The atrioventricular septum, which separates the right atrium from the left ventricle, then allows the flow of electricity. From there, it travels to the ventricles by the bundle of His, BH, and the Tawara branches. Both ventricles' Purkinje fibers aid in distributing the electrical current to the nearby cardiac muscles. The heart is surrounded by a unique sac. It has inner and exterior layers and is referred to by doctors as the pericardium. The inner layer is a double-layer serous membrane, whereas the robust outer layer is a fibrous membrane. The pericardial fluid, which serves as the heart's lubricant, is also produced by the serous membrane. First, the pericardium prevents the heart from rubbing against the surrounding organs. Secondly, to keep the heart in a stable place within the chest, and thirdly, to safeguard the heart against infection. There are two distinct nerves in the heart. The vagus nerve connects directly to the brainstem, and there are additional nerves that are linked to the sympathetic trunk. The heartbeat is not directly controlled by either nerve, but both have an impact on it depending on how the body is feeling overall. The vagus nerve in particular sends impulses that slow down the heartbeat. Signals from the sympathetic trunk, on the other hand, cause the heartbeat to quicken. The first organ to reach completion is the heart. In actuality, the heart develops into its full capacity even before an embryo develops into a fetus. This can occur as early as the first 3 weeks of pregnancy. Fetal and embryonic hearts have a little opening between the left and right atriums before birth. Due to the fact that embryos and fetuses rely on their mother for oxygen, this enables blood to skip the lungs. But after birth, the heart naturally seals the hole and resumes normal function. Cardiac output, CO, is the term used to describe how much blood the heart pumps each minute. An adult human's heart pumps about 5.25 liters of blood every minute on average. However, the precise amount varies from person to person and can range from 4 to 8 liters each minute. First, doctors determine a patient's stroke volume, SV, or the volume of blood pumped by each ventricle. The heart rate, which is calculated minute by minute, is then multiplied. The number of times a heart beats in a minute varies with age. Beginning with a heartbeat comparable to that of their mother, embryos and fetuses eventually reach a maximum heart rate of 185 beats per minute around the 7th week of pregnancy. It slows down around the 9th week, reaching about 145 beats per minute at delivery. It slows down even more after birth, to about 129 beats per minute, and keeps slowing down as the infant grows. Adult heart rates normally range from 60 to 100 beats per minute. Atherosclerosis is the cause of CAD. The accumulation of fatty deposits known as plaques inside a person's arteries is referred to as atherosclerosis. The arteries become more constricted as a result of these plaques, which hinders blood flow through them. However, even slight artery constriction won't harm the body or the heart. However, if they get too narrow, CAD develops, with heart attacks as a potentially fatal sign. Heart failure can be caused by a number of things. The most frequent risk factors for heart failure are being overweight and having high blood pressure. While they don't directly cause heart failure, they do contribute to disorders like CAD that can eventually result in it. Diabetes, hypertension, high blood cholesterol, and even smoking are other illnesses and causes that can cause heart failure. The muscles of the heart can also be directly harmed by a number of disorders. Cardiomyopathies are a group of illnesses that damage the heart's muscles in a variety of ways. For instance, hypertrophic cardiomyopathy results in an unnatural thickening of the heart's muscles. This reduces their receptivity to the electrical pulses of the heart and lessens the heart's capacity to pump blood. The heart becomes abnormally enlarged and weaker with dilated cardiomyopathy, whereas the heart becomes rigid with restricted cardiomyopathy. Most frequently, these illnesses are a type of inherited illness. The valves of the heart can also go sick on their own. These conditions are referred to as valvular heart disease by doctors. These have a variety of effects on the heart's valves. For instance, stenotic valve disease causes the valve to open too narrowly, which makes it challenging for blood to flow through the heart. Contrarily, valvular regurgitation causes the valves to malfunction to the point that the blood flow is actually reversed. The most prevalent cause of these disorders is aging, although they can also be brought on by other conditions, including rheumatism. The heart's irregular heartbeat is caused by arrhythmia. Heart palpitations are one of the many signs of arrhythmia. Blackouts are another symptom, and the most severe ones include heart failure and possibly stroke. Additionally, the pericardium can get sick on its own. These illnesses, which medical professionals collectively refer to as pericarditis, often result in the pericardium swelling. These illnesses are typically brought on by viruses such as the Epstein-Barr virus, Coxsackie virus, and cytomegalovirus. These conditions frequently result in fluid accumulation within the pericardium, which presses down on the heart. Low blood pressure arises from this, which could be fatal. Some individuals are born with damaged hearts. However, medical professionals prefer to refer to these conditions as congenital heart malformations. The patent foramen ovale, where the atriums from before birth don't adequately shut, is one of the less serious ones. Hypoplastic left heart syndrome, in which the left side of the heart experiences multiple states of inadequate development, is a significant example of a congenital cardiac defect. These include an atrium or ventricle that is too small, valves that are too narrow, or simply no valves at all. A damaged heart can truly cause death. Typically, the phrase dying from a broken heart conjures up cliches from radio or television soap operas. But doctors are aware that it is a rare but seriously dangerous illness. It particularly affects those who are experiencing particularly severe depression, such as that brought on by the recent death of a loved one. The body releases depressive hormones when in this situation, which can actually weaken or even stop the heart from pumping. The character actually passes away from a shattered heart, just like in fiction. Rarely does someone develop heart cancer. This results from the fact that cancer essentially entails an unchecked cell proliferation in the body. Heart cells, however, only have a limited capacity for growth or even self-repair. This can be a concern if the heart is hurt, but it also means that the heart almost never develops cancer on its own. There are numerous ways for doctors to assess the health of the heart. The easiest way entails merely listening for the heartbeat using a stethoscope or one's bare hands. Another typical technique for assessing the health of the heart is to feel for the pulse either at the wrist or in the neck. Blood pressure readings and heartbeat electrical impulse measurements with an electrocardiograph are more sophisticated techniques. There are also invasive ways to see the heart, which often involve inserting a tiny camera on the end of a very thin cable through a tiny hole in the chest. There are also non-invasive techniques, such as ultrasonography, magnetic resonance imaging, MRI, computer tomography, CT, and positron emission tomography, PET. There are some forms of heart disease without symptoms. The body simply adjusts to slight heartbeat anomalies, which demonstrates the case for arrhythmia in particular. Patients simply need to visit the doctor sometimes to ensure that their disease isn't becoming worse over time, otherwise, they can lead totally normal lives. In fact, some illnesses increase the risk of heart disease. For instance, drinking or drug misuse are two disorders that might lead to cardiomyopathy. In addition to its other symptoms, strep throat and endocarditis can also result in valvular heart disease as extra consequences. Pericarditis can develop from various medical problems, including cancer and renal failure, in addition to viral infections. The illnesses of the heart are likewise subject to a variety of treatments. The medications nitroglycerin for CAD and even aspirin to lower the risk of stroke are some of the most straightforward treatments. There are also other medications available for diseases that are more severe, including as calcium or sodium channel blockers for those with severe arrhythmia. For the most severe situations, surgeons perform so-called heart bypass surgery, which involves widening arteries or even bypassing completely clogged parts. Artificial valves can be used to replace damaged valves during additional heart surgeries. Pacemakers can control how quickly a heart beats. The world over, these tiny implants, which are about the size of a matchbox car, have saved the lives of millions of individuals. In actuality, up to 600,000 people a year have pacemakers put. These incredible devices are used by doctors to control hearts that are no longer able to control themselves. A pacemaker, which is implanted exactly next to the heart, produces the correct electrical impulses required to keep the heart beating normally. External pacemakers were first created in 1926, and after decades of development, they were first used in 1958. The following year, work on internal pacemakers started, and they were used in medicine for the first time in the 1960s. Heart transplants are a high-risk procedure. So much so that when it comes to keeping patients with heart issues alive, doctors view them as a last choice. This results from the reality that the patient's body will eventually reject a transplanted organ, even if the healthy donor has a blood type match. Patients are compelled to take anti-rejection medications as a result, however these depress the immune system of the body, making the patient vulnerable to injection. The issue was anticipated by doctors even before the first heart transplant in 1967. But even then, they were powerless to prevent their patient, Louis Washkinsky, from getting pneumonia, dying from it only 18 days later. This necessitates continual observation from both patients and physicians in order to reduce the danger of infection and rejection. The greatest method of treating heart disease is still prevention. Your heart's health can be greatly improved by doing something as simple as quitting smoking, abstaining from drugs, and limiting your alcohol intake. The heart benefits greatly from a nutritious diet, regular exercise, and an active lifestyle. In fact, physicians would rather prevent the onset of a heart problem than have to offer a treatment option after it occurs. The heart has traditionally held significant symbolism in every major religion and culture, even as far back as ancient times. The god Anubis was seen by the ancient Egyptians as testing the dead's hearts to determine whether they were worthy of entering the afterlife. Additionally, according to Abrahamic traditions, the heart is connected to God's throne, which later inspired people to venerate Christ's heart. The heart serves as the wellspring of knowledge and understanding in Taoism and Hinduism. Greco-Roman scholars went so far as to disregard any evidence that suggested the brain was the true source of thought and reason in favor of their heart-centered theory. Native Americans in Mesoamerica believed that the heart, which contained a piece of the sun's fire, was the source of all life. As a result, it became a part of their religion to offer the hearts of living sacrifices to the sun. Animal hearts are an ingredient in some dishes. Hearts are a nutrient-dense source of protein, and because they are a muscular organ, the flesh is solid and dry. For dishes that feature heart meat and frequently incorporate other organs in the mix, this usually results in slow cooking. In recipes like the Brazilian churrasco de curacao, the Indonesian chicken heart satay, and the Japanese hado yakitori, hearts can also be grilled. Animals can be without hearts. Worms, for instance, don't require blood because they directly take in oxygen through a network of connecting tubes. Mollusks and insects likewise don't have true hearts. Instead, they have a different muscle that runs the length of their bodies. This muscle maintains the flow of blood through a network of connecting tubes and a different chamber known as the hemocoel. Birds and mammals both have the same heart pattern. Birds inherited a four-chambered heart design from their dinosaur ancestors, who evolved into a four-chambered heart out of necessity given their large bodies. Mammals developed a four-chambered heart similarly, in what scientists call parallel evolution. Mammals and birds also share a distinction that both make up the only warm-blooded vertebrates. This has led scientists to consider the theory that only warm-blooded animals have four-chambered hearts. That's for now. We appreciate you being here. View more our channel videos.